conference will now be recorded.
Everybody got the email with minutes? Any additions or corrections?
I think that on the minutes, I think the date's wrong now, isn't it? On the regular meeting? I think it said August 19th and it's November 18th or something. That's the only thing that's wrong.
Yeah, when did we meet?
November 18th, I think.
November 18th. Right, yep, we'll fix that. Thank you.
Cause I was looking at them, I'm like,
Yeah, I just copied the old one.
Okay.
Update everything.
oh, that's fine.
Got a motion to approve the amended minutes?
I'll make a motion to approve.
All in favor? Carried. Claims.
Okay, the only claim that we had from last time was Dave's travel, and, oh no.
No travel, cause we had no claims last time.
Yeah, cause you had a board meeting. So
Oh,
yeah,
that's right. Thank you. So this month's claim is for Dave's travel, which the state mileage rate has gone up to 0.725. So it's like $1 addition from what it used to be. So his claim is for $31.90 for today. That's the only claim.
Got a motion to approve claims?
Motion to approve the claim.
Moved and seconded to approve the claim. All in favor? Carried.
Fantastic. We don't have any other things that we've spent our money on, so we still have $1,110 in our account.
Reports.
Okay, I will start with mine. This time of the year is fairly uneventful, which is glorious in the world of strategic planning and getting our, feet under us for the upcoming year. So we have done a lot of grant reviews now that everything is officially funded, and strategic planning, shifting up things. Partly in cause because Shiloh has departed from our office and we've chosen not to retire. So we're just going to operate within the three of us and we'll be able to manage everything that we see in our foreseeable future. So that's not going to be a problem there. Some of the things that we've done in the last quarter, we had a family gratitude night at the Shelby basketball games where we offered 47 free admissions to the game versus CJI, which when I talked with the principal at the time, he said it was a very well attended event. So we are very happy with that. This was in partnership with the Mental Health Advisory Board to promote gratitude and just positive mental health and well-being. We did some fun giveaways as part of a Sober Life Living mini grant that we got out of Great Falls. They sponsor in our area and all the other areas that they serve family-centered activities promoting sober living, because we know that in our small communities there's not always things to do that involve being sober. And so we're going to help promote things throughout the course of the year to do things as family activities in a sober setting. So we had a handful of families that are in active recovery come, and then a handful of people that are, just participants of the community. So that's positive.
how do they do the admission? First 47 or?
So we did it two ways. We printed off these admission tickets and we kept them at different locations that people could pick up ahead of time, which they did. A handful of families did that. And then when I went to the game on Friday, I collected what was left from those locations, took them to the gate admission desk, and said the first people to come through that are paying customers, just let them in and tell them why it was sponsored. Which unfortunately was not a lot of Shelby people that got free admission because a lot of them have activity passes. But Chester is also in our region of the same grant. So we serve dual populations, really, is what was kind of cool about that. Linda Van de Sant does their program in Chester. So Chester got to reap the benefits of our region project as well. So, and then the rest of them were just given to the people that came for the JV games because God bless them, they deserve it. They sat there for a long time, some of them. So and there was 47 total because it was a $350 grant. So that was fun. had lots of, just discussions and chats, and that's what we're there for, so. We hosted family game night this fall, twice a month, every other week. We did have minimal participation, so we're gonna review that. And again, it's just kind of like a sober family activity event. So we're gonna relook at that, maybe some timing, and maybe do more of like a summer activity with kids versus like a family activity during the fall when, there's school that's just getting started and all the things. So we'll review that program, but we do have a ton of games that if anybody needed a game for any events, we got lots of them.
Does it have to be a game night, or could you do like a,
It doesn't have to be anything. It can be anything. That's just kind of how we started. We purchased a lot of games, and we're hoping to get like just family involvement.
Logan Health did a, one night where they rented the movie theater, so you had free admission, and that might be a way too, is just to do some, free admission to the movie, and
Yeah.
then the participants still have to buy their snacks, but that'd be nice, so.
Yeah, I love that. We have lots of ideas, like bowling and the movies and things like that. The tricky part comes down to like logistics, right? Like 'cause it's always after hours, and it's always, and we're all busy running in different directions. So yes, we're gonna look at a lot more of those type of activities.
I don't know what the cost would be with the movie thing, you can maybe get bigger bang for the buck. There's more seats you can have.
Right? Yeah, it's fun. There's not a cap on how many activities we can do. We just have to do a mini application for it caps at $350 per activity. But we'll try to do more of them. Yeah. We also met with the Clover Buds. We meet with them pretty routinely, but this time we were focusing on dental health. Our WIC program is up and running in full force with several families, and we looked yesterday, we're serving about 100 individuals. Now, families is a little bit less because some families have multiple people using the program, but it looks to be around 100 participants, which is fantastic. There's always room for more, so always refer to our WIC program. It's for 5 and under, but we're happy with those numbers. Blood pressure checks we're doing at the senior center once a month, every month. That's good, getting just some networking there. We also got approval for a mini grant for gun safety, which will be completed in the next 3 to 6 months. It has to be completed by June. It's a $5,000 grant to focus on mental health support around gun safety, gun locks, gun safes, anything sort of gun related. Shiloh put in for this grant, had a beautiful application, so we're going to try to fulfill that by the end of June. We're hoping to partner with somebody to kind of help us along with the program, but as of right now, that's what we're going to do. Shiloh completed her work here, and so she has gone, but grants and programs will continue per the usual. Yeah, lots going on, lots of movement. I do have, you see on there, a Kratom discussion I would love to have with Ron when he comes, because we just listened to a presentation given out of Butte, Silverbow County about Kratom, and it's a legal version of drug use, basically, because it's not FDA regulated. But it's basically an opioid over the counter. And so they're using the sanitarians to have enforcement over this product not being sold. Because it's deadly. They're Kratom.
Never even heard of
Yeah.
that.
It's always been around. It's primarily sold at gas stations. On a low amount use, it's for a stimulant, and it's a lot like caffeine, but on a higher dose, it's an opioid, and it acts as an opioid, and it will kill you in high doses. And out of Butte, Silverbow, they had some deaths related to it, not primarily caused by it, but related, found in their system. And just over the state line in Idaho Falls, they had 4 deaths, and that were directly contributed to Kratom use only was the substance found. And so right now it's being sold at gas stations, primarily vape shops, tobacco shops, things like that. But what Butte Silverbow found was that because it's not an FDA regulated product, it can't be sold in places that are licensed establishments. So when you're a licensed establishment, you can only sell licensed product, and this is an unlicensed product. And so what they're doing is they're using their county sanitarians to go into licensed establishments and tell them to cease sales. So that would stop sales in convenience stores, restaurants, Albertsons, Walmart, town pumps, things like that, which then hopefully pushes it to vape shops, tobacco shops where you have to be 21 anyway. So they're trying to keep it out of the hands of kids. And so there's a lot of laws and code annotated that helps the sanitarians and the county attorneys to keep that out of those locations. So I think it's one of those things that as it catches steam and because it was passed in the 19 legislation that this was not allowed, but to gain momentum, these bigger counties are catching on to it, which then will trickle down to us. And what we're hoping for is, like, if Town Pump gets in trouble in Butte, they're just going to take it off all the shelves in their town pumps because they know it's going to hopefully trickle down, which, we can maybe get behind that. So we're hoping that it kind of takes care of itself on a larger scale so that we don't have to on a smaller scale. But it is one of those things where it involves the county sanitarian and legal action if they don't stop selling it in the licensed establishment. So that was very informative. We're hoping to learn more. There's a conference coming up in April that our office will be attending, and they're going to do a larger presentation hopefully on this, that we can then learn more about it and bring it back. And it's been around, I don't know if you remember when Mary Miller held this grant, she was actively pushing for Kratom to not be involved, and so it's been around for quite a while.
But like lots of you, I had no idea it was even a thing.
Yeah, I've never even heard of it.
Yeah, I've heard of it in the news. And you don't have to be a certain age to buy it. You can buy it at any age, right?
I don't think so. They're trying to also push that it is like a 21 and over thing, but anybody can buy it. And I know that some of Mary's work involved putting it behind the counter so that it wasn't like easily accessible to just everybody, or easily like in visual cue. Behind the counter they at least have to ask for it, and maybe that's intimidating enough to turn them off.
Sell by that name, or how do you have to look to see what?
So it sells by Kratom, but also Butte Silverbow was noticing that some of the vape shops were selling it as 7OH, I think. 7OH, and so some of the shops, so it comes in drink, in pills, in mixes. So if you notice, there's apparently a shop in Butte that has 7OH on it, and that's just another name for Kratom. Just like as their sign outside advertising. So this 7OH is another Kratom thing, because that's the substance that's made up of. Yeah, good times. So we'll keep up the efforts in preventing that to be in the hands of kids.
But the free I just did on it. I mean, if it finds out, why?
I don't know. They didn't get into that in their talk as much. We don't know. But it must avoid it somehow because naloxone does not work on it.
Oh, wow.
I think they said naloxone works, but you have to like double, triple, quadruple the dose of naloxone. You have to stop offering that part.
EMS is encouraged to continue giving naloxone because typically it's given, like, if you're using Kratom, you're typically using other substances that naloxone might work on. So they still want you to give it and to use it just knowing that it might not work as you expect it to work. So there's still more to come. There's a lot more to come. And I think, a lot of effort that they're doing marketing-wise is this is a plant substance and it's totally normal and it's found in, the wild and it's just an herb. Just an urban substance. Yeah, as is arsenic, as is botulism, as is all the things. So,
Arsenic's a natural.
Cocaine's a natural leaf.
Yeah, it's not a big deal.
Try it, you'll like it.
Yeah. So there's a lot of movement, right? But they make money on selling it. We don't make money on preventing it.
Right.
So that's, and it's all about marketing, it seems. So yes, we will continue to keep that at the forefront. And we're hoping to learn more at this conference coming up this spring. So that's my report. I was hoping that Ron would be here. Manifested man. He usually has the most entertaining report. Fingers crossed. Good morning, you're right on cue. I just finished my report, now we're eagerly awaiting yours.
Oh, okay.
We're gonna throw you to the fire right away.
Move right into it here, huh? 20 minutes online with, the state is, gonna take me a while to adjust. It's so screwed up over there. Don't hold back, tell us what you really think.
The meeting is being recorded though.
Okay. Easy things first. I've begun the inspection cycle for the 2026. We go from January through December. Proved an ownership change for the Shelby Walk and Roll. That changed hands. I think John, the previous manager, is still working there, but I'm not sure what that whole relationship is. I also reviewed the used to be TLC, the little cottage catering, that's changing hands. I think they're in process now, but I went through the facility with Samantha and everything was okay. Approved the licensure of Barbed Wire Coffee Shop in Sunburst, replacing Joni's Early Bird. In a way, it's a different establishment, but doing pretty much the same thing. Had a truck fire on Interstate north of Shelby. Blair called me initially on that. And it was on Christmas Eve, totally destroyed a load of meat from Calgary, owned by a Hong Kong company. And I want to put out a special thanks to Cliff when these things occur. And we've got this state required protocol. Sometimes we go to the letter. Sometimes we have to improvise, and working with Cliff, it gets done properly every time. He's just outstanding. This one, we had a load of meat. It was on Christmas Eve. Landfill was closed on Friday. Rearranged for trucks. I think used county trucks to load the meat into. Unfortunately, it froze over the weekend, and they got it thawed out. And when the landfill opened, they buried it in the landfill. Technically, we are supposed to get a hold of the insurance company and get an approval. There's been some problems where it landfilled the product, and then the insurance company, the owner said, "Oh, it wasn't that bad. Could have sorted it." This one with the pictures, there wasn't any doubt. And we also have state law that animal parts like that need to be buried within 24 hours. Well, couldn't do 24 hours, but we did as soon as possible. So that's the kind of thing we have to improvise on. And right, I mean, the state was kept informed. I got hold of them, and it went pretty smoothly. I think it took a little bit of time for Cliff to finally get paid from the company, but I talked to him a couple days ago, and that was all taken care of.
Good.
He got paid. He was pretty happy about that. As I sort of touched on, DPHHS, environmental health and food safety, I guess the first thing they again changed the launch date for the new online inspection, and they have no idea where they're at with that. They've been having trouble getting their database coordinated with the company, and I guess everybody all the way up to the director has been involved in negotiation with them. They have no idea when they're going to.
Really?
So all of this hoopla, I guess it's typical. I shouldn't probably say it this way. Typical of what's been going on with that section since last year.
1900.
Then maybe this is part of that, but the 2026 licenses for licensed establishment have been delayed due to issues. We've been asked to review each individual license from the states that they're supposed to be doing. And they printed a whole bunch of them with expiration date of December 31st, 2025. So we're still looking to try to catch those. We were talking this morning about they're delayed, but, some licenses going out. All of the ones, the new ones that we've sent in, the checks are in the fiscal, but they can't get them transferred to the database as being paid, so there's a bug there. They're so far behind with licensing, they're going to trying to hire a temporary to help with it. The last time they hired temps to do this was 3 or 4 months ago, and that's ended up with all the problems we got now, so I have no idea where this thing's going.
Oh, boy.
I mean, it's one of those things you don't even know enough about how bad it's screwed up to even ask questions. So then she asked today if we're having any licensing issues to let them know which ones. Well, we don't know until they send us a damn license. So anyway, that's enough of that soapbox. It's just continuing problem. I don't know what they're doing over there, but they're sure good at adding time for us to put in, so. That's it, enough bitching.
Fantastic. That's a good report.
Other than that, everything's, as long as things within the county, everything's going smooth. It's the connection with the state that gets things screwed up. Any questions?
We were talking before you came a little bit about the substance called kratom. And Butte Silverbow County is taking legal action with their sanitarians to prevent the sale of kratom in licensed establishments because it's a non-FDA approved substance that's being sold. And so we just had a presentation about it last week or so, and we're going to learn more about it this spring. So maybe we'll come back to that discussion a little bit later. I'm hoping it's one of those things where the bigger counties are going to take this on as an issue and get the sale of the product out of licensed establishments, that we don't have to really push for it because they've already done the dirty work for us in places like Town Pump, Albertson, things like that. So more to come maybe on that, but hopefully we can just.
I'll look into that a little bit more, and
We have a
there's
lot
some
of
those products
Kodan tape.
that it depends on what kind of claim is being made with the product on the label.
Yeah.
And there's products that I dealt with down at Tuna in the past where we went through all of those products, determined which ones were being claimed as a dietary supplement, and then when you cross the line and you get into certain claims, then it becomes a drug.
Yeah.
And
I think that's where this is at, is that it's teetering that fine line, and they've found a way to get it out of the hands of kids is what they're trying to do.
Yeah, Food and Consumer Safety, I can recall, sent stuff out in the past, but I don't recall that there's ever been, as you mentioned, anything that having us go look for it and ban it from the shelves.
Yeah. It's a newer movement that's starting in Butte, Silverbow area, from their county attorney and all this stuff. So more to come. We'll visit maybe afterwards and show you what information we have.
Okay.
Yeah. Excellent.
Do you have any other discussion or action items?
No, I don't think so.
Our next scheduled meeting is May 12th.
Should be a work day for everybody.
Just a regular, right?
Oh yeah, sorry.
Yeah.
It will be just a regular meeting.
Motion to adjourn. All in favor? Opposed? Carried. See you in May.
Fantastic. Thank you guys so much for coming.
Yeah.
Oh, congrats on your,
Thank you. Thank you.
Sign something here. It says he was here.
Oh. Yeah, should play shuffleboard. Thanks, Blair.
Yeah, thank you. Thanks for coming.
Okay.
We'll see you again in 3 months. Actually, we won't. We'll see you before then.
What's that?
Um,
We get my hearing aid turned up.
Jenny has the code annotated stuff. It was such a fascinating presentation that they gave us. They had a sanitarian that was doing the investigation and then the health officer on this project. And there was something about this product not being FDA regulated. So therefore it couldn't be sold in places that were licensed establishments.
That's ridiculous.
Yeah, I don't know.
I mean, look at a town pump. There's a whole lot of stuff sold in there that.
But I think that they were claiming it to be something it wasn't, or that fine line that you were talking
It all depends
about.
on how the label, what they have on the label of the product. How
Yeah.
they're presenting it.
Yeah.
And that's where the gray area is. What's a dietary supplement? What is a non-food product? And then what's the drug?
Yeah. Yeah. This product called Kratom, at low doses is a stimulant, like caffeine or something, but at high doses it acts as an opioid and deals with pain receptors, and it's been the direct cause of death at high doses. So that's why they're trying to get it out of these establishments, because it's basically an over-the-counter pain medicine.
But the key action is FDA. They're dragging their feet. If it's in high doses, acts like an opioid, they should be adding it to controlled substances.
Yeah,
If
but it's not, and that's where the problem is,
Yeah.
because that'll probably take.
So if they're not taking the action, then at the grassroots level, for us to try to begin to take an action. I mean, what are they basing it on?
So there's Montana Code annotated stuff that they quoted, and I don't know, but they're taking legal action with their county attorney, and it has to do with Montana legislation. And so they went, rounds and rounds with like making sure that it was legal, that they could stop the sale of it, and they did. And so Bozeman or Gallatin County and Butte-Silverbow are starting the movement. Is kind of what's happening. Yeah. Which I love because.
Which has, for us, there's really no effect until the state comes out with some kind of a guideline to cover us from going in.
There already is.
There-
And that's how they found, so they're using, so we're trying to prevent it to be in the hands of people, especially kids. And so the prevention people found the loophole with the sanitation and licensed establishments. And so the licensed establishments are not allowed to sell this product as long as they're licensed, because it's not a sanitation approved product to be on their shelves. So that's the
But
movement.
see, that's where, what happens is that the people that are making those decisions are probably the food and consumer safety. And
Yeah.
they're reading the rule, how do you read the rules to say you can't sell that? But
I
you
don't
can
know,
turn around
because
and sell a whole bunch of other stuff
they-
that's non-food.
They must have found something, because county attorneys don't just take those on willy-nilly. And apparently the movement is already starting in Idaho, and that's kind of how they've gotten word of it. Because the Butte-Silverbow attorney is not gonna be like, okay, yeah, let's do this if it's not, pretty cut and dried. And it has something to do with Montana Code annotated in the 19 legislation. Jenny didn't have that easily accessible, so I'll have to, it was a video recording, I'll have to watch that video recording again and take some notes.
I'm just wondering if this thing's going on, why, food, if it's involving sanitariums, why environmental health, food safety section isn't putting stuff out concerning that?
I don't know. Start rocking the boat and ask a few questions. It's Butte and Gallatin.
CRATOM,
KR,
or KR, I'm
Yep.
sorry, KOM.
I think so, yeah.
You know, I know stuff has come out in the past. So January, Riverstone Health in Billings posted a prohibition to create, action following report.
At least 29 deaths.
What I think they said was that kratom is not a food source, so it cannot be sold in